Leader for the 36th Guam Legislature. Good morning. It's been a while.
Yes, good morning. Half a day. Happy New Year. Merry Christmas. It's the last day.
Yeah.
So
And
it's nice to see everyone, and good morning to the people of Guam.
You know, we didn't get to talk to you before the election, so congratulations.
Yes, I guess I'd like to take this time to thank the people of Guam for giving me this opportunity to serve them in another term, especially them understanding the situation that of me having to be on orders. I really am grateful that they continue to put their trust and confidence in me, and we're going to work hard this term to navigate through this precarious situation. So thank you.
Right, and you already introduced your first bill dealing with the opioid crisis on Guam. And I know when we had you on last year, this is something that really is a priority for you. So if you could tell us about the I guess, new and improved bill that you introduced.
Right, so we introduced bill number 6-36, which was an amendment to the GAR and also to the GCA, and it really focuses on allowing prescribers to be more open to the patients that they are prescribing opioid medications to. This is also part of the prescription drug monitoring program, really understanding the impacts and of the possibility of high addiction when you are prescribed opioids, because you develop a tolerance to the medication, and then you know, in some cases you evolve into harsher drugs that are Schedule 2 and 3 substances. And so we really want to find a way where we can meet the medical community and allow prescribers to be more transparent, and also be able to have the ability to look up history of the patients and understand really what the issues are that will help them to perhaps provide holistic alternatives or other pain management alternatives to benefit the patient. Last term, we had the public hearing thanks to Speaker Terlaje, and it was a very good public hearing. We had a lot of input from the community. And so the bill that we put out this term at the beginning is the bill that addresses the needs and the concerns that a lot of our medical professionals had during that public hearing. Mm-hmm. So hopefully this bill will bring us to the table and to really move forward in implementing this.
Mm-hmm. Well, you are also going to be chairing, once again, the Committee on Education. And before we get to Speaker Terlaje, she's also in the Zoom room, we do have weekly progress reports from the Superintendent of Education, John Fernandez. If we could bring him in now, because I know he's also got a lot of other things to do today. But John, thanks for coming on. Sorry about the little mix-up earlier. And I guess just real quickly, if you could give us the progress report for GDOE.
Well, first of all, I want to wish everyone a happy new year and congratulations to our speaker. And I say welcome back to our chairwoman of our Committee on Education. I have to be honest, and we were wondering, well, will she want to keep education, because it's such a, it's such a tough task, as she knows already, having served as the chair. And then this year is not going to get any easier. So just wanted to welcome them and Happy New Year, as well as let everybody know that we do have the committee is going to be hosting an informational session also next week on Tuesday at 3 p.m. Virtually, but the legislature will also be able to help get the message out to our community about what the plans are for school reopening. So we want to thank them for helping to facilitate that communication. And so I think that other than that, though, there's a lot of work that's going on, and as I know both our senators understand, there's just a lot of feelings on all sides of the issue about community health, reopening schools, and all the concerns, anxieties, and risks that are involved. And so we've taken a lot of time over the last few months to really think hard about strategies and also pay very close attention to the public health situation. And I'm very glad to say, in our monitoring of the CAR score and looking at our own framework, that things look really good right now. But obviously, we're waiting to see, that the 14 days after Christmas, after New Year's, we want to make sure that those numbers don't change, because otherwise, we've let the governor know that if those numbers change, we just really have to be, really have to ensure that we reconsider, plans in the event that the public health situation declines or gets worse due to, those two holidays. But other than that, we are planning again for the January 19th reopening date. We had a meeting yesterday with our board, but as you know, as of Monday, we had three additional board members that are new to the board, being Dr. Mary Okada, Mr. Robert Crisostomo, who also is a principal at St. Anthony's, and then Mr. Peter Atta, who was a returning board member and chair. And so we spent a lot of time not just going over the plan, but letting our new board members have an opportunity to ask questions and get up to speed so that we're all operating on the same page. And again, our teachers and staff have reported on Monday, and now are kind of working at every school to get the necessary training on the safety procedures, the new normal that we expect back at the school sites, and also an update on the numbers of face-to-face students that we actually anticipate back at school. So all those details are being ironed out, this week. We'll be out at the schools just to ensure that everybody has the support that they need, and if any concerns are raised, and just to make sure that we're aware of those and can address them before we welcome any student back. And I know that are a lot of tutorials and videos that will be coming out shortly regarding safety on buses, safety at schools, that we'll be pushing through our channels, and hopefully, with the governor's support through PBS and the governor's channels. And we ought to talk to the legislature as well. Any help we can get in just pushing those, that safety information out.
Don't forget KUAM.
Absolutely. Any help we can do we can get. Issa, our PIO, will be handling that, but I know she's been getting that together this last few days.
Mm-hmm. I wanted to bring up, because you mentioned Robert Crisostomo. We had him on last week in his capacity as the principal for St. Anthony's, and he was talking about how St. Anthony's is doing the pilot program with GHRA for rapid testing. And public health, they were on yesterday, and they were talking about how we have thousands upon thousands upon thousands of these rapid Binax test kits. So have you reached out, or have they reached out about the possibility of offering up any of these rapid COVID test kits to GDOE?
Yes, we are in active discussion to provide the Binax testing for school employees, so our educators and our staff, especially the ones who are going to be out at the school sites, and also looking at the possibility of students as well. So that's, it's still in the planning stage. So I don't get very comfortable until we have specific dates, mm-hmm. and, that we can push out to our people to be able to take advantage of the testing. But it's one way, we consider it a good, a way to screen, going into the reopening of schools, our employees and students, who, given the fact that we know vaccinations are not yet, able to be distributed to the educators and staff yet. Mm-hmm. But we're having both conversations. So vaccination, we're pushing and trying to assist the government in their vaccination strategies. We've made Okudu High School available, and we've worked with the school community there to just do what we can to ensure that there's a place that people can go and get through the vaccination priorities, so that we can get to a point where we can get our school employees vaccinated, the ones who are interested in. And then we know there are many who are not yet comfortable with the vaccination, but that's where the testing could come in. And right now, the public health did ask whether we were interested, because they did have the available tests. We of course jumped on it and proposed, certainly we can make the dates available, and we can, ensure that our employees get the word. But we are waiting a final, sort of a final plan as to how to get that done. I guess when they first discussed it, there was some thought that DOE would be able to administer it ourselves, through our nurses, but there is going to still be a need for logistical support from public health. So we wanted to make sure that, we have a smooth operation and we have the necessary support to carry that out.
We had the LT on yesterday. He mentioned that he would bet. He's not a betting person, but he said that he would bet and almost guaranteed that the governor would be changing the P-Corps status before the return of face-to-face. Have you heard when that's going to occur or anything about what P-Corps status we're going into?
Yeah, I'm absolutely not betting at all. I'm just going to go with the executive order that we know is out there and work with that within that authorization. And right now, it looks as if the governor is comfortable enough to go with a limited reopening. I mean, we still have a lot of safety requirements at the school sites. So, it's not going to be like we're able to bring everybody back at once. We still have to abide by physical distancing, the face mask, and so forth. So this will give us a starting point. And I think that's very important to just let the community know that on the 19th, that really is a starting point. It's not, it's not where we're going to end up. We do want to steadily expand the opportunity for face-to-face instruction. A lot of that's going to depend on the community health situation staying in a good position for us to stay open. And number two is going to take a lot of cooperation and collaboration at the school level between students, parents, teachers, and staff to ensure that all the safety requirements are met and that we operate a safe school environment before we expand any further for other students to come in.
Mm-hmm. And just real quickly, all their nurses are back to GDOE?
Yes, our nurses were able to return back to GDOE on January 4th. So they are participating in the training and the preparation. Our social workers are returning on the 11th. They also have been assisting with public health, but that's really to support GDOE's opening and the fact that we're such a large agency. But the reality is we are working on an MOU with public health because we don't want to abandon public health and our role in supporting public health as well. So what we're looking at is as we schedule the days for online learning and for face-to-face learning, when our school nurses and social workers are not required to be at the school sites, we are trying to plan opportunities to ensure that we assist with the testing, and the vaccination drives that public health is putting out there, because we also know that that'll affect our stakeholders as well. And it makes sense to just have a scheduled availability of our employees to assist with that, knowing that it'll help us in our efforts to keep schools and our community safe.
All right. Thank you so much, John. Was there anything else that you wanted to get out this week?
No, absolutely. No, I will. I think next week we'll be able to have our public hearing and some of the final details about reopening that we can push out to the community. And at this point, I didn't want to take any more time from our speaker and our chairwoman from our committee. So I just want to welcome them again. Happy New Year to everybody. And, we'll be there next week, to give you all the details, answer any questions that our legislature might have, and then hopefully make sure that more members of our community are up to speed with the latest information so that they're ready to go when the 19th arrives.
All right. Thanks a lot, John.
Okay, thank you.
We'll see you next week.
See you next week.
Okay. Again, John Fernandez giving us a progress report. He comes on the show every week to just kind of keep parents and stakeholders informed about as they prepare to return to face-to-face instruction on the 19th of January. So thanks again, John. Back in our Zoom room, again, we have Speaker Therese Terlaje and Majority Leader, Senator Telena Nelson. Thanks again, ladies. We'll go to Speaker Terlaje. Congratulations.
Thank you, Bree. Thank you, Andy. Good morning. And again, thanks for all the work that you've been doing, especially keeping us informed and bringing all these people from public health, education, the Lieutenant Governor regularly so we can all keep updated. We really appreciate it.
Well, it's a job, to make sure people are informed. So how excited are you about this speakership position?
Well, I'm excited. I'm excited for, just try another way, I think when, we've got some long-standing issues with the government, with Guam, and that we're going to try another way to tackle these. And so I'm just hoping to use this position to really get to the root of some of those longstanding issues and solve them, for the people of Guam as we move forward, and to be better prepared for any other emergency that's going to hit us, to be better prepared for any other crisis that we are going to face as a community. And we've learned so much from this pandemic that I think we would be foolish not to take heed of and act on. And so that's what I intend to do.
Mm-hmm.
And
Madam Speaker, you mentioned there being prepared,
Yes.
and because there's two big jobs you have is, recovery, the people need to get back on their feet. And then I think this pandemic really exposed how fragile the economy and the system is. So have there been ideas tossed around about how to, kind of shore up so we don't experience this kind of collapse again?
Absolutely, yes. And there are ideas, and I don't think there's a unanimous consent on those yet, but we're definitely going to work on that. I think consensus is how we're going to accomplish these things. And so, yes, ideas, especially diversification, of course, is one, but we've got systems that we just have to shore up no matter what, especially our healthcare system. That's, I think, the priority. We've seen that is the most fragile of all of our systems, right? And we first need to ensure that nothing is going to hit us as hard as this has. So we're going to take care of that. And but I'm very grateful for the support of my colleagues, and that I think they're all optimistic that they all seem ready to work very, very hard. As you've seen, our majority leader introduced bill on the first day, tackling another one of those very important issues, the opioid crisis and drug crisis that we have on Guam. This is one thing I think with her leadership we're going to be able to address as well, that we've all been trying since we got elected, is to get to the root of the drug issue on Guam. And it causes other, it's the root of crime, it's the root of many problems in families, and so we're going to do our best to get to the root of that. So I want to thank her for her work in that regard. But yeah, you're right, Andy. Lots of work to do, and we need to take all the ideas and hash them out.
Yeah, and we talked to some of the Republican senators, Senator Moreland Blouse Jr. They have their ideas, their bills, and everybody, like I said, we all want the same thing. We want to be safe. We want to be able to get back to work, be able to take care of our families, be able to live. And so they have their ideas how to get there. You guys have your ideas how to get there. And where exactly is the middle ground? Because everybody is saying we need to come together, but where are you going to come together to?
Well, I can't speak for everybody, so I think the middle ground is yet to be seen. However, for example, I think, of course, reducing taxes whenever we can is always a good idea. Reducing government expenditures, an even better idea, I think. And I think we've always, at least I have always supported that. I think Senator Nelson's the same. But, that's those two things. Yes, those are what we should be focusing on. So we're going to focus on that. However, we're looking at the reality of we cut $62 million in our last budget for FY21, $62 million in government expenditures. It's a huge cut, and yet we're looking at the new report from, I think it was December, that shows, up to December, we did not collect for the first quarter what they predicted we would. So even on top of that $62 million cut, we're facing a financial, something we're going to have to deal with immediately, I think. What are we going to do with the reduction in government revenue that is going to affect the critical services that we are providing? And so my goal is to make sure we continue to provide critical services, and all other services that are not critical, that might seem luxurious at a time where our finances are like this, that those be re-examined and pared down as much as possible.
What about you, Senator Nelson? What will be some of your priorities in the 36th?
Well, we have a lot of new committees under our office, and so really it's just finding a way on understanding how these committees operate and seeing how we can address the financial challenges through these different agencies, to better serve the people of Guam. Guam Department of Education is a huge task, and really I want to do my very best to support the board, and congratulations to all the new board members on their appointment and confirmation, and to really move forward to see what we can do for our island's children. There's a lot of our children suffering right now. A lot of our children are not receiving adequate education because of this precarious situation that we are in. And so really helping them put to task, how are we going to tackle some of these challenges in educating our children, meeting the boundaries that online education provides. And then also we have to deal with some of our infrastructural progresses, and border protection is one of my concerns. 2 terms ago, the police came, and the chief at the time stated that Guam does not have the capability to develop drugs, meth houses, in the most simplest terms. And so really, how are all these drugs coming into our borders? And the real big challenge also is for customs and quarantine, because we're not receiving any passengers. And so they're really strapped in how they're going to be able to operate. And so these are just some of the challenges we face, and some of the social challenges that we face, really. And we do have to start to look at our government and see where those critical areas are, to see how we can serve the people with these critical areas, and be able to help the people get back to their feet. Like the speaker said, there are so many ideas. And, I think we can come to that middle ground. I think we all have the same mission in mind. We all have the same belief that we're here to serve our people and want to see our island prosper. And if we stick to that, mission and focus on that mission with great humility, like our inaugural blessing from the priest, and then also Father Paul Gofigan's, everything is for God's glory. I think that we can move forward and really serve our people during this precarious time in a better way. We understand the dynamic now of COVID. It hit us, and we weren't ready for it. No one was ready for it. The world was not ready for it. And so now that we understand the dynamics, how do we evolve into this new situation? And I think that that's what we need to focus on. I'm always looking forward to bipartisanship work. We can't all be yes men in the room. We have to have someone saying no. We need collaborative minds to come together so that we can build back our island back to, a safer area, a safer place, and also addressing the protections that we need for the people of Guam.
You mentioned this, speaker, a new way, right? Going forward. Can I guess both of you kind of share then what were some of the lessons learned from the 35th?
Well, I think, look, as you just, most of the senators that are coming in, they are experienced. They are very passionate. They are coming in, after many of them with a lifetime of service to the government and to the people of Guam in very different capacities. And I expect that we can use all of those skills and capabilities to make policy better, to make communication with the people of Guam better. I think we could always use better in that regard, and you've helped us very much to get these messages across. And pretty much, I just think it's that disconnect, when the people can't understand why the legislature is doing certain things, prioritizing this over that, they lose trust. And I think we need to build trust, because when we need to act quickly, we need them to be right where we are, to know everything we know and why we are making the decision. And if it's a risk, to be with us, and that we're going to take this risk because we want to solve this problem. And this is the best way that we can see right now. And I don't want to create a further divide that, with the community. I think that hurts all of us, because we need to act together as a community. And one of the strengths of Guam is when we care for each other, and I want to foster that. I do not want to do the opposite. We need to care for each other. first, over politics, over partisanship, over anything else, over, Father chided us about, celebrity. All of that is second to, what do they need? We've got people suffering, Andy, as you said. Businesses are suffering, and that is causing great suffering in our families. As Senator Nelson said, the children are suffering. I don't think we've yet seen the real impact of this on them, and we're going to be seeing that in the years ahead. So we just have so much work to do, and so I'm just looking forward to this passion, this energy, this experience, and this dedication that I see in my colleagues. And so I just can't see. We have no excuse to go wrong. We should go right. We should go we should work together very well. And even if it's tough, and believe me, working together, sometimes it's not easy. It's tough. You've got to have the fortitude to withstand criticism. And, I am number one who likes to be criticized. I don't, but I will, if that's what it takes. We're going to listen to criticism. We have to listen to each other. And I think the more we can do that, that's a skill we're going to have to foster in each other, and just keep reminding each other that we are here for the people of Guam. First and foremost, we're here for them. We're not here for anyone else. We're here for them. The legislature was set up as an independent branch because of that, because, the people wanted a place to be represented against all other parts of the government. And they wanted a place of last resort to come to when the rest of the government is just not meeting their needs. And so we are going to be that for them. If I have any say in it, that is my goal.
Senator Nelson, lessons learned?
For me, I believe that it's a matter of keeping the mission in mind, that we are here to serve the people of Guam and to be united. And it's very difficult to move 15 different people with 15 different histories to be united. But we did it with 8 initially, right? So, right, Speaker? We were able to move forward, come out of caucus united. And what allowed us to do that was because we kept the mission in mind. We put all of our understandings aside, and we focused back on the mission, and that was to prioritize our people. And this is very difficult, in these times to see through all the fog of what politics that are being played. But if we focus on this, we can move forward together, united. And like the speaker said, we have a wealth of experience here in the legislature, and all of our senators are passionate, and we want to work together, united, to move our island forward. And it's true, the legislature is the branch that the people are the closest to. And so, we want to be able to meet the people there, to be able to help them and to serve them better. It was very difficult for us in the beginning last term because COVID was something new. This pandemic was something we've never experienced. But one of the lessons learned is that we need to focus on our healthcare. We need to prioritize our healthcare, our education, and really see, and we have to cut away some of the luxuries in the government that, that may cost us in the end.
When you say luxuries, what do you mean luxuries?
Well, there are some ticket prices, for example, HRRA. We're in this economic standstill, and it's a very, very powerful entity. And so we need to see what we can do to prioritize the funding elsewhere, prioritize the funding in our hospital, prioritize the funding to help our businesses stand back up, prioritize the funding for our education. Those type of agencies, right? They're very, they cost, but we don't see the work. We don't see anything produced from it. And so we got to look at those agencies and see where we can do to reprioritize the funding to areas that we need to, especially because, like the speaker said, we cut over $60 million in our budget last year. And it was a very difficult pill for me to swallow because, you know, Guam Department of Education also took a hit. And so I was very concerned with that because it is about our children. And now we're not collecting revenues that we anticipated that we would collect. And that's also very, very concerning for me. How are we going to move forward? We may need to address the budget again. And the Office of Finance and Budget Chair is going to give us this kind of information. He's been open with us about some of the challenges that he sees in the government, and we're waiting on him to lead the way in that and see where we're going to find a way to restructure the government.
So we're talking about possible reorganization, consolidating of agencies, things like that.
If I may jump in, yeah.
Mhm.
Some of it is also just, putting on hold some of these projects that we've had planned, because some of them are still excellent projects for the long run, but we are, suffering a temporary pause, I think, and that we need to prioritize where those pauses should be. So some of these are still beautiful projects for, revitalizing again Hagatnya and doing different things. But the expenditure part of those are going to have to be put on hold. And so I just think the legislature plays a key role in prioritizing what those should be and reprioritizing where we believe the money should go right now in the middle of, and hopefully at the end, but in the middle of this crisis still. We're concerned with there's a new strain of COVID, making its way around the world now. Yesterday, I was told that by the governor that this is in the United States now. They found it, and that so we are at risk again of this being brought to Guam. So we're not done yet with. We can't go forward without prioritizing vaccination, the tracing. Right, Sabrina, you've been on this since day one. The tracing and the testing together. These things have to be done in mass. They have to be done over and over. I mean, it's this, we can't let up on it. And we need a huge part of our population to undergo this and to be on board. And that's how we're going to open up businesses. And I think, we've given public health a lot of time to increase their capacity in this regard. And we've got private partners now helping us in this regard. We've got clinics that have been authorized to help us in these areas and other UOG, but so altogether, we should have a system ready to open businesses and just be able to do those three things: vaccinate, test, and trace as fast as possible. Because we're going to have to move on with businesses with COVID still in the community. However, controllable. With these three tools, I'm hoping. So yeah, I'm gonna, one of the first things I'm gonna do is check public health again. Like, where are we? Are we at where they've said we would be at? And is this good enough, to open businesses now? And can we move forward in that regard? So I'm very much looking forward to that. And I'm glad we're doing the vaccinations now. I understand they're going to expand this out into, 30 or some other entities to help vaccinate. And we're gonna get like a huge portion of our community vaccinated, maybe 70%. So I'm glad for that. Can't come soon enough when we've got children coming back to school, and we really want to see that happen. So thank you.
Did you say you talked to the governor? Yes.
So the governor, I learned when I became speaker that she has a weekly meeting by Zoom with the speaker and the chief justice and the head of the mayor's council. So yesterday we had a new head of the mayor's council and a new speaker, me. And so we met by Zoom with the governor. So it's a COVID meeting, she says, and so she's updating us with COVID. But so it's pretty much just to tell us those types of things. But, Bree, I'm going to tell you, when public health makes their announcements on your station, they are absolutely giving us up-to-date information. So yeah, like for example, yesterday, they talked about the opening it up to the 60 and 60 and over vaccination to vaccinate 60 years and over, and that's one of the things the governor told us. So I think you're very well informed still. And but I'm going to take whatever information is given to me at these meetings, of course, and share it with my colleagues. And I think it's this openness and communication that I'm going to strive to do my best at, and so that everyone's promptly informed. I think COVID, one of the biggest challenges is we didn't think we were informed well enough in many things, and expenditure of CARES money in public health reaction. And so we tried, and you helped us very much to get this information, not just to us, but to the public, where everybody needs it at the same time, so we can all move together at the same time. And so it's going to be challenging, but I am committed to that. So I'm going to do that.
So you finally getting a seat at the table for the Physicians Advisory Group meetings?
Not yet. Still working on that. I'm going to invite them to a seat at my table down at the legislature and see how that works. That's why.
Oh! Jason did the mic drop. All right. Well, thank you, Speaker and Majority Leader, for coming on the show. Was there any final comments you wanted to make? Telena, we'll start.
I just want to say, I don't know if you noticed, so in sessions, right, we have, of course, a speaker, but the session's really led by the majority leader, because the majority leader is the one who's got control of the floor, knows, what we're attempting to do in there and how we're going to get that done. And they're the ones who have to have command of not just the rules, but, of the colleagues, of what their intentions are, how to help them, how to, help get things across in the way that they are intended, as opposed to, we don't want to make a mess of it. So I just want to thank Senator Nelson for continuing in this capacity. I think she's very good at it, and she is a person that I think she's a very good leader in this regard. She's able to assess what the needs are of the members of the body and able to translate that into action on the floor. And so I want to thank her she's going to really help me to be an effective speaker, I think, if she's able to do that effectively on the floor. So I just want to thank her in advance for her work in that regard and her willingness to do that, because, some of us, we anticipate it might be contentious, and, we don't want to be in the middle of that, but she's very willing to lead us through this. So I appreciate that very much.
Contentious? I just heard Carla Branch is going to be over at the legislature, the executive director. Were you surprised? You said contentious. I heard Carla Branch was going to be the executive director. Were you surprised?
Oh, yes, I was surprised. I am surprised. Just learned that yesterday, probably same time as you.
Got to communicate. Come on, people. Senator Nelson, any final comments?
Yes, I just want to thank my colleagues, for really allowing us to move forward together, for being united. Also for the people of Guam, to thank them for keeping us in check, reminding us of that we are here to serve the people of Guam, and that the legislature is here to serve you. And so please, if there are any ideas, if there are any recommendations on how we can move the people forward together, our offices are open. Right? This is what you elected us to do. You elected us to serve you, to work for you, and to address the needs. And so really, we cannot do this on our own. We're 15 people, and we have different ideas, but we also need the public to give us some ideas on how we can bring our island back and to a safe area, to regrow our economy, to look in different areas. And we need that from everyone. We need that from our local businesses. We need proposals. We need help to find solutions, because we cannot do it alone. And we will definitely do what we need to do to help the people move forward, because it is important that we are united together, especially during this very difficult time that our island faces. United is preferred. We cannot be divided at this time. We need to be able to meet together and to appreciate our differences, but to always move forward and to keep the mission in mind that we want to bring our island back and be help to evolve through this new normal. Maybe with COVID, a new strain of COVID, we're going to have another new normal, right? So we don't know. We don't know. We're in such a precarious situation. So please continue to pray for us. And, you know, my office is always open to the people. So please do not hesitate to reach out to contact all of us and me. Thank you. Thank you, Sabrina. And thank you,
Thank
Andy.
you. Thank you guys. And you know,
Thank you.
our phone lines, our microphones, we're always going to be available whenever you guys need to get anything out to the community. So thank you.
Appreciate that. And thanks to everybody. Thank
All
you.
right.
Take
Stay safe.
care. Happy New Year.
Happy New Year. All right, Speaker Therese Terlaje, Senator Telena Nelson. Looks like